Senator, I have a couple of questions for you. One, if government health care is so terrible, why do our veterans have it? Why do our active duty military have it? Why do you have it?
Most Americans are satisfied with the health insurance that they have. They do not want to have a government health insurance. So all I can tell you is that I do not believe that the costs that would be borne from a government health insurance system, which I just read to you, when they can get affordable and available health care in other ways, is the answer. What's your second question?
Well, the problem is the people who are satisfied are the people who can get health insurance.
That's why we have to make it affordable and available.
Competition is already there. Unfortunately, it's just like competing against like. Public option is competition. I am satisfied with my health insurance. However,
let me just say, if we do the quote public option, which is the government option, then we have 1,501 health insurers in the country. If, however, what is going to happen if you have this government option is it's going to crowd out all the other private health insurers, and Americans will not be able to.
My name is Fred Linsenmeyer. Why don't I have the health insurance that you've got? Because I'm paying for it, and I'm paying for the person in the United States health insurance and Congress health insurance. Why don't I have that? I'm unemployed. You work in the middle, and you got a better health insurance than I've got, and I'm paying my tax report.
Exactly right. That's why I want to make health care insurance available and affordable to you, sir. That's my goal, is to make health insurance available and affordable to you. Good. I'm trying to get it for you. Thanks very much. I'll do it. We'll do it. We'll make it affordable and available to you.
My medication alone costs over $40,000. That's not doctors, specialists, therapy, orthopedic devices, just my medication. Now, without my medication, I can't even feed myself. I have another gentleman who had the exact same plan as I do, but he changed to Medicare Advantage. We have the same secondary, the same Medicare, goes to the same pharmacy, gets the same thing, but we're paying the state or whoever for Medicare Advantage, and there's no better coverage. Another person I know is self-employed. They do not make enough, and they cannot afford their insurance. And second, the insurance company won't cover them because they have a pre-existing condition, yet they're not disabled, so Medicare can cover them. Now the thing is, if this person doesn't get care, they're going to get chronically ill, and that's going to cost a whole lot of money. Now, I just want to say something else, Senator McCain. If we look at our country now and the government, we've been pointing fingers, blaming, and arguing. Look where we're at. Let's stop labeling and criticizing and saying that's conservative, that's liberal, that's Republican, that's Democrat. Let's just look for what works and give the Americans. If I didn't have Medicare, which is a public plan, which is socialized medicine, I doubt any insurance company would cover it. Right. So maybe the public option, without it, I'd be very, very sick.
Well, let me just say again, thank you, sir, and thank you for informing us. But this establishment of risk pools, as I pointed out, is exactly aimed at your situation. We must establish risk pools so that you will have the insurance that you have to have, which will provide you with the medication and the care that you deserve as an American. That's why we need to fix the problem. We need to fix the problem, and I'm committed to fixing the problem that you articulate so eloquently. Go ahead.
Get private insurance. Trust me, I would.
Sir.
I contributed to Social Security and maxed out my benefits, and there's no way in the world I put in enough to pay for $40,000.
I fully
And that
understand.
is ridiculous. That medication doesn't cost that much.
Well, thank you, sir.